I'm here to give you an update on the fight against the COVID-19 pandemic in our dear state. As we are all aware, there is a surge in the incidence of COVID-19 nationwide at the moment. In Anambra, I've repeatedly warned that as we ramp up our testing campaign, the number of COVID-19 cases will go up. It should not surprise anyone, therefore, that the number of COVID-19 cases has gone up in our dear state with the increased number of testing. Interestingly, that is the pattern of the nationwide spread of pandemic at this moment in time. However, as I have assured you in my previous addresses, we have made an adequate arrangement to contain this virus in Anambra State. So I would advise everyone to remain calm. There is no need to panic. If we continue to carry out all the safety measures outlined in the COVID-19 protocol, mainly wear your face mask when you're in public, social distancing, washing of hands, using of hand sanitizers, and what have you, we will certainly avoid that. If we continue to carry out all the safety measures outlined in COVID-19 protocol by both the World Health Organization and the Nigerian Center for Disease Control, we shall survive this pandemic. I will now give you an update on our COVID-19 challenges. In Anambra, following our active search campaign across the state, we have collected a total of 302 samples so far. Out of this figure, 230 results have been released to us, while 72 results are still pending by the NCDC testing center. Out of the 230 results that have been released to us, 53 results returned positive. 53 results returned positive. 13 patients have been discharged, and we have recorded 9 deaths, while 31 cases are still active. In the meantime, 7 patients are in our protective care center receiving medical attention. In Anambra, it is important to note that the medical status of 7 of the 9 patients who died of COVID-19 in the state was confirmed after a post-mortem test on them. It was found out that they were comorbidity cases. That means they had an underlying disease and they were being treated for those diseases by the private hospitals they went to. It was only on death that our attention was drawn to the people, and we collected their specimen and tested and found them to also have COVID-19 case. As a matter of fact, only one fellow did not have a case of the 9 deaths. Only one fellow did not have a case of traveling. The rest were going up and down doing their business outside Anambra State. And of the dead, about 4 of them are not from Anambra State, but they reside here, so they are one of us. This is why I must warn that delay is often dangerous in the management of COVID-19 cases. People who show symptoms of this deadly virus are advised to report their conditions early, as it increases the chances of surviving this pandemic. I must also inform you that almost 90% of the people that have died of COVID-19 in our state were aged from 60 years and above. It is therefore important that people who fall into this age category and who are said to have what the experts call comorbidity should maintain a high level of vigilance to minimize chances of their exposure to this virus. In Anambra, I must also emphasize that this pandemic does not select its victims based on age. In fact, one of the victims of the virus in this state was only 24 years old. And this is why we must all maintain a high level of vigilance to survive this scourge. The COVID-19 law. In Anambra, I cannot conclude this address without reminding you that the Anambra State COVID-19 and other dangerous diseases prevention an eradication law has come into effect. The law makes it an offense for anyone to appear in public without wearing a face mask. It is therefore important that we observe this law diligently. Don't walk on the streets of Anambra State without face mask. You'll be arrested, you pay the fine, or you pay the fine plus the community service. The churches should not admit anybody into the church without a face mask and other proper COVID rules. The markets should not allow anybody to come into their midst to buy anything without face mask. You know, these things are very important. The hotels and what have you should not entertain customers without face mask. The people, the commuters entering buses, commercial buses and what have you, must wear face mask in the buses. Face masks are to be worn to cover the mouth and nose, and not to be worn on the neck like most people are doing now. Please ensure that you obey these things. This disease is with us, and the only chance you have to survive it is to obey the laws as stipulated. In the Anambra, I cannot conclude this address again without emphasizing what I've just told you now. I advise everyone to ensure strict compliance of this law. Our health workers, as we intensify efforts in ongoing active case search campaign, the increase in positive cases will definitely test the resolve and capacity of our healthcare workers. These people are our first line of defense against this pandemic, and we must always reserve a kind word for them. They are putting in a lot of work to ensure that this virus allows our people the chance to breathe. So far, our healthcare workers have justified our confidence in them with their impressive performance. In conclusion, ụmụnne onye ndị ilo gbara gburugburu na-eche onwe ya nche mgbe niile. The COVID-19 pandemic is an enemy that seeks to surround humanity with its virulent touch. In the Anambra, only the grace of God and our own eternal vigilance will save us from this onslaught of this pandemic. I have no doubt that if we continue to maintain a high level of vigilance by complying with the standard of COVID-19 protocol from the World Health Organization and NCDC, we shall outlive this pandemic. Jisinike, una dakwanamba, umunnem. God bless Anambra State. God bless Federal Republic of Nigeria. Thank you very much.